Now that we've looked at the bony features of the nasal cavity, the paranasal sinuses, and the nasopharynx, let's see what this region looks like in the living body. We'll start with the entry to the air passage that forms such a distinctive feature of the face, the external nose. The skin over the upper, bony part of the nasal framework is thin and mobile. The skin over the lower, cartilaginous part is thicker and fixed to the underlying structures. The openings which form the beginning of the air passage are the nostrils, also called the anterior nares. We'll remove the skin from one half of the nose so that we can see the underlying structures. The edge of the bony opening for the nose, the piriform aperture, is here. Here's the nasal bone. The two nasal bones, united in the midline, form the bridge of the nose down to here. From here, almost to the tip, the bridge of the nose is formed by the front edge of the septal cartilage, which we'll see more fully in a minute. On each side, the framework of the nose is formed by two slender pieces of cartilage, the lateral cartilage and the alar cartilage. The lateral cartilage is thin and flat. In front, it's continuous with the septal cartilage. The alar cartilage has two parts, the lateral crus and the medial crus. The lateral crus forms the curved outer framework of the nostril. The medial crus turns sharply backwards, ending here. Together, the two medial crura form the framework of the lowest, most anterior part of the nasal septum, which is called the columella. To get a good look at the nasal septum, we'll divide the bone and soft tissues along this line and remove the left side of the face. Here's the nasal septum. Before we look at it, let's get oriented. Here's the anterior cranial fossa. Here's the bony palate, or hard palate, with the soft palate extending behind it. Here's the oral cavity. Here's the opening of the right nasal cavity. Behind it is the nasopharynx, which we'll look at in a minute. The nasal septum extends from here behind to here in front. This small part of the septum is covered with skin. The rest of it is covered with this layer of mucous membrane. We'll remove a small piece of the mucous membrane so that we can appreciate its thickness. The highest part of the septum is the specialized olfactory area. It contains some of the fibers and nerve endings of the olfactory nerve, which are the sensory receptors for our sense of smell. The cribriform plate, which the olfactory nerve fibers go through, is at this level. Now we'll remove all the mucous membrane from the septum so that we can see the underlying cartilage and bone. This part of the septum is bone, as we've already seen. This part is formed by the septal cartilage. In this specimen, there's an unusual defect in the cartilage here. In front, the septal cartilage forms the bridge of the nose down to here, then runs downward and backward to attach to this bony prominence on the maxilla, the anterior nasal spine. Now we'll remove the whole of the nasal septum so that we can see the lateral wall and floor of the nasal cavity. The inside of the nostril, up to the lower border of the lateral cartilage, which is here, is called the nasal vestibule. It's lined with skin. The rest of the nasal cavity is lined with mucous membrane. Here are the conchae, superior, middle, and inferior. The mucous membrane that covers them is richly supplied with mucus glands and with blood vessels. The complex surfaces of the conchae have important functions in humidifying the inspired air and warming it. This olfactory area, like the corresponding area on the septum, contains olfactory nerve fibers and nerve endings. All the paranasal sinuses and the nasolacrimal duct for the tears open into the nasal cavity. To see their openings into the nasal cavity, we'll remove the conchae. The inferior concha was here. Here beneath it is the opening for the nasolacrimal duct. Beneath the middle concha, which was here, is a deep groove called the semilunar hiatus. To see where this leads, we'll retract its lower border with this thread. The semilunar hiatus leads into a narrow, irregular side chamber called the infundibulum. The infundibulum receives the openings of the frontal sinus and the maxillary sinus. Sometimes the more anterior ethmoid air cells open into the infundibulum too. Sometimes, as in this case, they open separately, below the middle concha. Here's where the superior concha was. The more posterior ethmoid air cells open below the superior concha. The sphenoid sinus, which is this cavity, opens forwards into the highest part of the nasal cavity, the sphenoethmoidal recess. Here's the frontal sinus cavity in a different specimen. The opening to the frontonasal duct is behind here. To see the other sinus cavities, we'll take a look from the outside at a dissection in which all the facial soft tissues have been removed. Here's the maxillary sinus cavity, opened from in front. The opening from the sinus into the infundibulum is all the way up here on the medial wall. Here are the ethmoid air cells, with the lamina papyracea removed. This opening in the medial wall of the orbit also exposes the infundibulum. Now we'll move back and look at the nasopharynx. To do that, we'll put the nasal septum back in place. Here's the right half of the nasopharynx. The openings from the two nasal cavities into the nasopharynx, here's the right one, are called the choanae, or posterior nares. The roof of the nasopharynx lies underneath the basilar part of the occipital bone. The back of the nasopharynx lies in front of the atlas vertebra. Here's the anterior arch of the atlas. In the mucosa of the lateral wall of the nasopharynx, there's a pronounced inward fold called the torus tubarius. It's produced by the inward projection of the cartilage of the auditory tube. The mucosal opening of the tube is here. Behind the torus tubarius is a deep recess, the pharyngeal recess. The floor of the nasopharynx is formed by the soft palate, which forms a highly mobile partition between the nasopharynx and the back of the oral cavity. The nasopharynx opens downward into the oropharynx. The soft palate can move upwards, backwards, and downwards. Its movements, which are important in swallowing and in speech, are produced by several small muscles. These converge on the soft palate from above and from below. Most of them insert on a sheet of aponeurosis, or tendon-like material, that occupies this part of the palate. In this section, we'll see only the palatal muscles that come from above. We'll see the ones that come from below in the next section. The two that we'll see now are the levator palati and the tensor palati. To see these muscles, we'll remove the mucosa of the nasopharynx. Here's the end of the cartilage of the auditory tube. Here below it is the levator palati muscle. Its full name is the levator veli palatini. Levator palati arises here on the petrous temporal bone. It passes along the underside of the auditory tube, runs downward and medially, and joins in the midline with its fellow from the other side, forming a sling. Levator palati moves the soft palate upwards and backwards. To see the tensor palati muscle, we'll remove the levator. Here's tensor palati. Tensor palati arises from this area, just above the root of the medial pterygoid plate. Here's the edge of the medial pterygoid plate. The fibers of tensor palati pass